Okay. So, welcome back, everyone, to our weekly live broadcast brought to you by Mary Stopes Sylvia Leon. I'm excited to have you all here again. Please, if you are just joining us, as usual, please tell us your name and where you are joining from. Of course, we can even see your name. Just tell us where you are joining from. You are joining from Makini, if you are joining from Bo, if you are joining from Freetown, any part, Kabbalah, please join us and right where you are joining us from, where you are watching from. You are welcome. Do you remember the same way we did it last? Okay, best believe the same way we did it last week. We'll be doing something similar today. Thank you for joining us. Yeah, you are welcome. Best believe. Thank you for coming. Cheering up Bashir Bar. You are welcome. Thanks for joining. Please, if you are just joining, okay, Yawazazi. Okay, I'm catching. Yeah, I can see those that are joining early. And the same way we did it last week, we'll go that same route this week again. So thank you so much for joining us. You are welcome to our weekly live broadcast brought to you by Mary Stopes Sylvia Leon. If you are just joining us, please indicate where you are joining from. Indicate where you are joining from, and also do well to also share this live. Share this link. It will not even cost you anything. All you need to do is just share, forward to your contact list, share it with your friends on Facebook, and let us all learn together. So we have Best Believe, Bashirba, Yawa, Salamatu Kanun. Thank you so much for joining. It's our pleasure. We are so glad to have you here. Please indicate where you are joining from. George Lamin, thank you for coming. Please indicate where you are joining from. You are welcome to this week live broadcast brought to you by Mary Stopes Sylvia Leon. This week we've got a whole lot of things we want to talk about. We've got a whole lot of things we want to talk about, and trust me, we are here to always learn, to also relearn and unlearn at the same time. Karim Kamara, you are welcome. Albert A.A. James, you are welcome. Chrissy, you are welcome. Please indicate where you are joining from. Indicate where you are joining from. We really want to know. Yes, let the love, tap. Of course, we deserve it. We both deserve it. So it works hand in hand. Thank you for joining from Sierra Leone. Where exactly are you joining from, George Lamin? Are you in Freetown? Are you in Kissy? Anywhere you are joining from, we really want to know. We listen, we don't judge. I agree with you. Yawa, thank you for joining from Waterloo. Please do well to share this link with your friends, with your Facebook friends. Even your enemy will learn. Today is like, I am pumped. We have a whole lot we want to discuss about. And I'm even super excited that we have a whole lot of guys joining in today, because today is your day. Forget about it. Today is your day. You have all. Yeah, no, thank you for joining us. Good afternoon. Where are you joining us from? Margaret Mansare, where are you joining us from? You are welcome to this week live broadcast brought to you by Mary Stopes Sylvia Leon. Loretta Williams, thank you for joining. Okay, Bashiruba Kenema, yeah, you are welcome. Thank you for joining us. Please do well to share this live with your friends, with your enemies, with everybody that anybody you have, even people you don't know, just send it to them, because we all have to learn. We all have to take charge of our health. This 2025. Yeah, no, thank you from KC Edwin Dumbuya from Tonkolili. Thank you for joining us. Margaret Mansare, thank you. Thank you, George Lamy from Bodi Street. Thank you for joining us. Osmes, yes, I can remember you from Montecourt. I think last week you were here too. Okay, all right. Magib Sawi, you are welcome. Thank you for joining us. George, thank you for joining us. Best believe we listen, we don't judge. Honestly, trust me, that's why we are here. Yawasasi, Frances Kunda, what's it called? Francis Kunda, thank you for joining us. We are glad to have you here. What's not to love about Auntie Marie? I'm surprised though. Obviously, there's nothing you should not love about Auntie Marie. Please don't forget, share this live. Share this live. Just forward it. Share it with everybody on your contact list. Everybody. You don't wait. Yes, so God bless you too. Auntie Marie for you. Like anything, Auntie Marie will do anything for you. If you are double tapping, please double tap. Like. What's not to like about Auntie Marie? What's not to like about Auntie Marie? Please do it freely. It will not even cost you extra data. It will not cost you extra fee. Please just go ahead. I'm just waiting till 3:10. In 10 minutes, we are going live and we'll start. From Lebanon, Memunatu, thank you for joining. Atora, Thank you for joining. Thank you. Thank you. I really want to know where you people are joining from because it is very important. Take for instance, now I think Cimex or something, I know that name already. It has stick. So whatsoever, anywhere I see him, I can always identify this is our person. Leo, thank you so much. You too. You're not looking bad. I would like to know where you're watching us from. Please do well to that's the only thing that is required of you. Just two things. Number one, if you want to keep the rolling. Like he's giving me energy. Keep it rolling, rolling, rolling. Yeah, that's all. Then next thing, if you want to, if it is not even if you want to, please do well to share this link. Just share it with your friends, share it with everybody on your contact list, on Facebook, put it on your story. It is not a bad thing. And the interesting thing is that education, health doesn't have to be boring. And that's where Auntie Marie is here for you. So we have just 2 minutes to go. And I don't know, why do you want to be stingy? You don't have to be stingy. Share this on your story. Share this link with your friend. Let them join. And even as you are joining, thank you so much, Abate James. Thank you, thank you. As you are joining too, please let us know where you are joining us from. Auntie Marie is here for you today. We are here together. We'll learn together. Everything. Trust me, we are here for you today. Please, please, and please, as you are joining, please drop where location you are watching from. Do well to like this this Facebook Live. Also, and do well to share with your friends. Thank you for joining us. Thank you for joining us. Adama is Fofana from Makini. Thank you. You are welcome. You are welcome to this live broadcast. And today, in the next 1 minute, we are going with full force. We are going with full force. Yeah, thank you so much. Sending lots of love to the full team. Thank you so much, Bondu. Auntie Marie loves you too. Auntie Marie loves you too. Thank you so much for joining. I'm not seeing enough people. Where are these people? Please, if your friend is not here, send that link to your friend now. If you are liking, if you are showing love, just show this love. Auntie Marie loves you. Why won't you show the same love? And just share this link. Tell us where you are coming from. You are sharing this because of my looks. Thank you so much. Anything for you. I mean, anything. Thank you so much. Thank you so much. In few seconds, we are going live and direct. So we're starting. I want to say you are welcome to this week live broadcast brought to you by Mary. Stop Sierra Leone. We are so excited to have you again. And guess what? Last week we had a beautiful time together. And trust me, Auntie Marie sees it as a privilege to connect with you all, where people can always come out to learn and also ask their bothering question. Now, we love you so much. Sending love, hug from Auntie Marie. Thank you. I know many of you joined last week. A lot of people asked some thoughtful questions. You got answer to your questions as well. And some even won some good giveaways. I mean, awesome giveaway. Thank you so much. It's a privilege to always do this to the community. And today we are keeping that same energy. Today we are keeping that same energy and it must not drop. The same energy that we kept last week, we asked thoughtful questions, even awkward questions. Please feel free to ask. And we have a lot of things to discuss with you today as well. Most especially my men them. I'm here for you today. A lot of times people have asked, do you treat men? Or what about this for men? And this for men and women? Please don't say because of this you are leaving, because you have to learn for your brother, you have to learn for your friend, for your husband and all of that. Thank you so much. Please, if you are joining, don't forget to drop where you are watching us from. I really want to know where you are joining from. Buya, thank you so much for joining. Pals, thank you for joining. You are welcome. Michael, you are welcome. Nali Barry, you are welcome. Ambassador Muhammad, welcome. Julia, thank you. So I will start from the very important one. So over the course of the week, I heard some people were saying something like, there was this post about a guy saying, no, I don't really want to wear the protection. I prefer that you take the after pills and everything, the backup. But then the real question, is it only unprotected sex? I mean, is it only unplanned pregnancy that we want to prevent? What about the STI? What happens? And I saw a particular comment under that post that says that men do not have infection. Who is deceiving you? Who is giving you this information? I've told you, anything Auntie Marie does not say, don't take it into consideration. Now, I will be answering two things basically. Number one is that the cover, which is the condom, is good enough for any size. And even if you are talking about size, I don't know what kind of size are you even talking about. It's fit for every size, every and any size. Don't, women, you are listening to me, do not let any man lie to you that no, I don't have my size, that's why we don't have to do. It is not true. In fact, if you get our Maristopes, our condom, trust me, it fits perfectly. We call it 2-in-1. Just go to any of the stores, any pharmacy, and ask for flame condoms. You get it. So, men, there's no excuse for you again not to protect. It's not just about unplanned pregnancy. You should be responsible. If women are taking responsibility to prevent unplanned pregnancy, let's do well now. Let's do it to also prevent ourselves from STIs. You might not have it as a man, but what about the person that you are dealing with? You never can tell. And at the same time, you don't want to jeopardize what's pleasure. It matters a whole lot. So that is that on that. Condoms does not use any size. No matter what your size is, it will work for everybody. So moving on, I will be addressing the second post under this. And I think last week I promised somebody, he said when we would talk about erectile dysfunction. So we are here to talk about it. The interesting thing is that a whole lot of people deal with erectile dysfunction. It is even more common than you think. Peradventure, because my profession, of course, over time I have helped men over time to get back to work and all of that. But it is more common. So you as a man now, that you have decided not to talk about it, you are only harming yourself, because a whole lot of people go about having erectile dysfunction, or ED as we popularly known, and there are treatments available to it. So let's discuss about it. Erectile dysfunction simply means inability to achieve erection. Note, inability to achieve or sustain erection satisfactory enough for optimal sexual performance. Now, for some people, they might start, then few seconds or few minutes into the do, it stops working. And you have to start kicking all over again. That's erectile dysfunction. For some people, you have to kickstart over time, and it's not just coming up. You have warmed everything, you have warmed the engine, you have done a whole lot of things, it's still not coming up. That is erectile dysfunction. And this is one truth about erectile dysfunction. Occasionally, one can have erectile dysfunction. I mean, there are times that you don't just feel the urge, or you are not able to achieve erection. It is normal. It happens that way. But when it becomes something that is persistent, my brother, run to any of the anti-marriage center. Run, pick race, because it's ready to just end you. It doesn't have to go like that. It doesn't have to be permanent. There are solutions to this. And it comes in different forms. Number one, it could be inability to achieve erection. That means you cannot achieve erection at all. Number two, it can be reduce or inability to sustain the erection. Now you have started the work, then all of a sudden you press brake, or it presses the brake. Now that one too is another form of erectile dysfunction. Another one is even the quick ejaculation is another sexual dysfunction. And lastly, loss of interest in sexual activities, which we call low libido, is another form of sexual dysfunction. All of this happen to a whole lot of people. So let's discuss what causes it. There are a whole lot of things that cause it. There are a whole lot of factors to take into consideration. That is why if you just decide that, oh, you are going through the erectile dysfunction, and all of a sudden you start taking this and that, you might be doing it the wrong way, and you are even harming yourself the more, because you have to address what the root cause is. If you are not doing that, you are just deceiving yourself, and you are just taking chances, and the more you do that, is more dangerous. So number one is that there can be some clinical health conditions. Take for instance, there can be conditions like severe hypertension can cause it. In fact, some people do have sexual dysfunction or erectile dysfunction that the underlying cause is severe hypertension until they come to our center. That's when we'll be able to detect. Now, for that kind of person, if you start taking all of these substances that you take, you are not addressing the root cause of the root cause of that problem. And at that point in time, you are even harming yourself, because whatsoever concoction you are taking, it will have a negative feedback on the kidney too, which is not safe. So severe hypertension with kidney breakdown, that will just end the person's life. Another thing is diabetes, chronic infection, chronic clinical diseases like diabetes. It has been found to be another cause, medical cause of diabetes. In the same vein with hypertension, some people do not know that they have this. It's until they come into the center, because we do an holistic examination or evaluation of whatever you are coming with. Moving on to that, from that, there are some psychological factors or emotional factors. Talk about anxiety, talk about stress. Yes, stress can cause erectile dysfunction. Anxiety can cause it. Being broke, if you are broke, it can result in, I know some men here, they can testify to it. When you don't have much in your pocket, there's nothing that is working. But when it becomes persistent too, there might be another issue out there. Then, hormonal imbalance. Yes, it might sound strange, but men too can have hormonal imbalance. Not only women do have hormonal imbalance. So all of these things are things that we'll put into consideration before starting or commencing a treatment. And trust me, that self-medication that you are doing, I know you have heard a lot of people have used a particular medication, it's worked for them. But what if the cause of that erectile dysfunction in that person is not the same with yours? You won't still get it. You won't get it right. That's why it is very important that you run down to the doctor and let them examine you, basically. So moving on, this is the good news. There are treatments available for erectile dysfunction. There are treatments, like a whole lot of treatments available for erectile dysfunction. It's not a final, it's not a do or die. It is not a death sentence. Erectile dysfunction, yes, it happens. It happens to a whole lot of people, even more than you can imagine, and there are treatments available. So, men, stop that thing. Stop that thing that you've been taking over time that you think you want to use it to improve your sexual performance. Come to the center. Let us know what the problem is. So if you are just joining us, we want to say thank you for coming. Thank you for joining us. We'd like to know where you are joining from. And don't forget, if you find this broadcast helpful, which I'm very sure, please don't forget to like and share this link. Secondly, we are talking about, let me add to it. This has over time been a debate on this particular platform. When we put out health informations and we say that excessive alcohol and smoking has been found to be factors causing of this, and all of you say no. Let me tell you, I will reiterate again. If your lifestyle is not pleasing enough, you do things in excess, it will affect you. And in another video, I'm going to address that. So let's move forward. Also this week, we talked about not only women go through menopause, men can also go through that stage. And that takes me to andropause. A lot of you will be wondering, what is andropause? When you saw it, most likely, what is andropause? How can andropause? How can men? How can this? Yes, it do happen. And basically what happens in andropause is that there's reduction in the level of hormone. It's a case of hormonal imbalance too in men. And that hormone is called the testosterone. The testosterone is also known as the fertility hormone. But unlike in women, for men, the testosterone, when it withdraws or the level begins to drop, leading to andropause in men, it doesn't just disappear. It doesn't just wear everything off immediately. It is a gradual process, unlike in women that they just stop menstruating all of a sudden. No. For men, it's a gradual process. That's why every sign your body is giving to you is showing you should not take it for granted. You should not just ignore anything that you notice. Now, for men, how can you know that you have a low testosterone or you are going through andropause? Number one, there will be low libido. Yeah, you are not interested in. Very good question, Henrietta Marshall. What causes breast milk? I will address it very soon. You have low libido, you are not interested. For some people, there might be muscle loss because that particular hormone is men hormone. Is one that helps you in building all those muscles that you are using to show and all of that. And at times, you might have difficulty in concentration. You can have irritability. All of this happens and can be as a result of stress too. If you are going through stress, you can as well come up with some signs of andropause. Now, andropause, like I said, if a man is going through andropause, definitely it will affect your fertility. And over time in our center, we have seen a good number of men that have come in as a result of that. And the moment they take the treatment, everything disappears. Yes, that's the good thing, because you have medication, you have treatments available for this. So if you are noticing that suddenly you are, although even up to age 60 and 70, you still have some men that are able to impregnate. Now that is to tell you that andropause happens in stages, unlike in women whereby everything will just stop, no menstruation, then there are no eggs again. So moving on to the next question, that and don't forget there's a treatment for it. And if you are feeling any way, don't forget to book an appointment with us. Moving on, I'll be talking about premature ejaculation. I think in a way, I addressed it first when I was talking about what's it called, erectile dysfunction. So what is premature ejaculation? Premature ejaculation is having to ejaculate just before you are able to achieve your satisfactory sexual performance. You have just started the do. You have just started the activity. And before you know it, boom, everything is out. You have not been able to satisfy your sexual performance or either that of your partner. And of course, for that one too, there are treatments. That's it. If you don't have the right information, you might be missing out. If you don't have the right information, you might not know what to do. You might be going through the wrong behavioral approach to it. And it can be psychological, it can be physical. For some people, they have anxiety when it comes to performance, because maybe due to their past experiences, maybe their past what's it called, partner told them they were not doing enough. And as a result of that, if you are going to another relationship or going into another partner, you have this anxiety, and that can lead to premature ejaculation. There are some infections too that can actually cause it through, as well as some psychological stress or disorder. Don't forget there's a treatment for it. Just walking into our center, any of our center across the Aberdeen, Kisi, Waterloo Street, Waterloo Rural, Bo, Makini, we got you. Now, talking about erectile dysfunction, talking about premature ejaculation and all of that, a lot of time people feel that when it comes to getting pregnant or fertility, it only applies to the woman. That is totally wrong. It is wrong. There's nothing like that. Fertility or subfertility or inability to achieve pregnancy both depends on the man and the woman. Now, both of them even have equal chances. It is just 50% contribution. Now, let's stop this over time that we have to blame the woman for not getting pregnant and everything. There was a post that we posted about 2 weeks ago or a week ago, where like, you think that your withdrawal game is strong. Have you even checked yourself? Yeah, a lot of men, hey, my withdrawal game is strong. What if there's an issue with that sperm? What if everything is not going on well from your end? So that is why it is very important. Your sexual health is very important. Now, subfertility or infertility refers to your wife not being able to achieve pregnancy after consistent, unprotected sex for a period of 1 year, 12 months. Now, this also brings me back to newlywed couple. And after 1 month, after 2 months, you say, no, I'm not able to, I have infertility. No, it doesn't work that way. It has to be persistent. At least you should have sexual intercourse 3 to 5 days. 3 to 5 days or times in a week. And some people are even doing it the wrong way. You are not even tracking your ovulation. Over time in our center, one of the things we always do to you is to help you track your ovulation. Some people do not understand how the menstrual cycle works, and that has proven at times you don't need so much. And when you start taking folic acid, that's another topic I want to talk about. You start taking folic acid, you are taking these supplements and everything, just feels like you are not. That's why you need an expert like Auntie Marie to help you look at where the problem is coming from. Now, fertility has to do with both men and women. And men, you have to check yourself. Your withdrawal game might not be strong. It might not be the reason why your partner is not getting pregnant. There might be issues. And yes, men can check for fertility. There are a range of tests that you can do. You can check for your testosterone. You can do the seminal fluid analysis. And if you are doing the sperm test, which is seminal fluid analysis, we don't just want to look at it. We will look at it holistically. We want to look at it qualitatively and quantitatively. We want to know the quantity you are producing. Some people, all of a sudden, you just say, this thing is not watery. The fact that it is watery does not mean that it is not potent. But how will you know if you don't have this test done? We want to check the appearance. The appearance matters a whole lot. You need to check the appearance. Is it bloody? Is it clouded? Is it giving yellowish discoloration? Those are the things that we want to, so those are the things that we really want to look at when we are talking about fertility. We want to know the count of the sperms that are there. If it is low, it is treatable. We want to know if there's an ongoing infection in there too. So those ones are very important. And improving it, very possible. With therapy, it can be improved. Lifestyle modification, smoking, excessive alcohol, you have to let go. Wearing tight panties, you have to let go. Putting your phone in your pocket, that exposes your sperm cells to radiation. You have to let go all of that. I want to believe that we are learning something. And I'm not saying the likes. It feels like you people, you are not listening or you are not learning. But I want to believe if you have learned something so far, please double tap. Double tap. I want to see that like. So moving on, I said it's men, I am here for you so that you can know the range of services that we'll provide for men. We'll also talk about your prostate health. I can't see that enough like, oh. Like. So let me quickly go through some of the questions before I move on to the next topic that we'll be talking about when it comes to men. I think we're okay, no problem, that's fine. If I have not welcomed you, please don't forget to just write. How long should a man last before ejaculating? It depends on you. But then it depends on how long a man can serve. But at times, even if you are too excited, you cannot control it. You ejaculate easily. But at the same time, it doesn't have to happen over time. Yeah, it depends. How well you are connected to your partner to also determines. Connection, emotional connection. If you are not connected emotionally to your partner, you are just saying you'll come out and everything is just out there. So it basically depends on you and how healthy you are. What medicine is good to quickly conceive? I presume what medicine is over and over again. I have said it, trying to achieve pregnancy is not just something that you can just think about. Okay, take this medication. It doesn't work that way. It is an holistic approach. That's why it is being called management and not under management. We have the treatment. So if you are talking about the tabs, if you are talking about the vitamin and all of that to take, you are talking about the treatment. But then when you are being given the drugs or you try to get a drug somewhere and everything, and you are still not able to achieve pregnancy, do you know you're not treating the cause? They're different. Last week I talked about different reasons why different people might be having what? Inability. They might be dealing with inability to conceive and all of that. So it's not basically just one medicine is the best. We want to look at why is the person not getting pregnant? For how long have you been trying? Have you been pregnant before? Do you have kids before? Have you had any surgery before? All of those ones, they have factors in causing what? Inability to conceive. And those are the things that we want to look at. The treatment is the last resort. It's after you have been able to identify what the problem is. That's when you can give treatment, basically. I hope I've been able to answer your question. I think I've been able to answer your question. I'm still taking time to go through. Is it possible for a guy to impregnate a lady with condom? Very important question. I mean, fantastic question. Now, it all depends on how effective the condom was. Talking about you taking condom, I mean, putting on a condom. Did you check the expiry date? Was there any leakage, any trauma or any hole in that condom? If there is anything like that, it will happen. But provided that it's a new condom, it has never turned before, not expired, friction didn't happen at the point in time that it got turned and everything. I don't want to agree. I will not say more than that. I will just say because you are using a condom to prevent unplanned pregnancy. Now leading to pregnancy, where is it leaking out? Except there's a leak. If there's no leak, it's not likely. And that is why condom is very good for you. And if you have been using the wrong condom, the flame condom is here for you, available at pharmacies and stores. Trust me, we are still coming back to discuss more. Is it possible for a guy to impregnate a lady with condom? Yes, I've been able to answer that. What causes breast milk without pregnancy? Very important question too. I told you, you people are just so brilliant people. Now, having to secrete breast milk without pregnancy is an abnormality. It is not expected to happen. It's a total abnormality and it is one of the causes of subfertility, inability to achieve pregnancy. The medical time for this situation is called hyperprolactinemia. It is not a big English. Hyperprolactinemia. The hormone responsible for breast milk supply is the prolactin. But when it is in excess, it will lead to what? Excreting of breast milk and all of that. A minute, please. Okay, I'm back. So when that begins to happen, that means the hormone basically is too much, is high. There's a control center a control center in our brain that regulates this. But when it goes haywire and it is in excess, it will lead to inability to conceive, and you begin to see the breast milk. And this is very important for you women. That is why breast self-examination is not all about just examining for cancer or what have you. You also want to know if there's anything coming out. So when there is excess of this hormone, it will lead to what? It will lead to you expressing breast milk from your breast, even while, and that's in a way, as a negative feedback, it will send a message to your brain that this person does not need to ovulate now. This person does not need a baby right now because the person is breastfeeding. And if you express his breast milk and your partner or your man has over time been helping you to suck too, it will keep coming. Yes. The same way when a baby lashes on the breast and you are breastfeeding, there will be more outpour. If your man has been helping you with that, you have to stop now. You have to stop now. The good news again, there's a treatment for it. There's treatment available for excessive or expressive breast milk from the breast without being pregnant. Do you understand how it works now? It's an abnormality. There is excess prolactin in the body, which is leading to excretion of breast milk when you are not pregnant. And it sends a message back to your brain that this person does not need to ovulate because this person has what? Has a baby right now. So you have to book an appointment today. It's one of the causes of fertility. And for a lot of people, immediately after taking this medication or the treatment, depending, basically for people that have high prolactinemia, everything resolves and they are able to achieve pregnancy. Okay. Cure of premature ejaculation. Don't forget, earlier I mentioned that there are different reasons why you might be having premature ejaculation, ranging from psychological, emotional, physical, medical issues and all of that. So we have to be able to look at it holistically. What is the cause? Then we'll be able to address what the cause is. But trust me, there's a treatment for that as well. What is the age limit for a woman to give birth? Now, the way it works is that for women or for the male gender, the moment you are being given birth to, you have the total number of eggs that you use all through your lifetime, and they begin to degenerate. As what's it called? At every point in time that you menstruate, you lose some eggs, you lose some eggs, you lose some eggs. But it is advisable for you up to age of 35. Up to the age of 35, try to achieve pregnancy. And if you have been trying to achieve pregnancy and you are not getting pregnant up to 35 and you are sitting down, that's the high risk for you. Because at that point in time, there are still healthy eggs that we can actually help work on through medications and other treatments that will help you conceive. From 35 and above, the fecundity, we call it fecundity, that's the age of being fertile enough, begin to drop gradually. But that doesn't mean that after 35 you cannot give birth. I hope I've been able to answer your question. Is this a general knowledge or a specific topic? You are welcome. General knowledge, specific, sexual and reproductive health, Auntie Marie is here for you. How to determine healthy sperm. I mentioned earlier, you cannot just look at it and say, hey, it looks like water. It's drawing like okra. It doesn't work that way. You have to have a test done. And we have the test being done in our centers where you can examine your sperm health. When you cross 30, is it hard to get pregnant? I just addressed that not quite long. We are here to, how are twins made? Is it from the man dispatched or they are formed inside the womb? So for twin, basically, they are made from God. Let me start from that way. Yeah, twins are made from God. The way twins happen is that basically when you release an egg, just one, you have two fallopian tubes, and in your two fallopian tubes, you can release egg from either of the two. Now, let's assume that you release just one egg for that month, and you are ovulating, you had an unprotected sex. After you have an unprotected sex, sperm are being released. And those sperms, they are as fast as possible. That's why over time, when people feel that the reason why they are not getting pregnant is that because after having sexual intercourse, they see some fluid coming out, and that's no. Those things, they are faster than you can take. They are faster than it's in boat. I'm telling you, because the moment your man discharges inside, they begin to run. And the first one, basically, to get where the egg is the one that will fertilize that egg. After that, the gate is closed. Others will do what? They will find a way, the body will find a way to absorb them. So when that happens, it gets in there. During the process of now dividing, there's a process that it involves medically whereby the eggs begin to divide. Then, peradventure, you have two sperm fertilize one egg, can result in twin, or maybe you released multiple eggs. Maybe that month you released more than one egg, and what's it called? So at that point in time, you have one egg, or you have one sperm fertilize this, the other sperm fertilize this. So twins are being made that way. And they can be monozygotic or dizygotic. Like, they can be identical. If it is just same egg that two sperm fertilizes, it can be identical, or if they are separate, basically. So as they continue to grow, they'll be able to identify, the identification of being identical or not begins to happen. Depending, when they separate, they can have different umbilical cord and different sac, or they have the same sac and the same, the same umbilical cord, or placenta, basically. So basically, it all depends on both the man and the woman, not just one person. But when it comes to gender, basically, the man decides. Because for you as a woman, you have the chromosome we call XX, and the man has XY. XX means female, female. XY means one male, one female. So when the man discharges the sperm in there, and if it is the sperm cell that carries the X chromosome gets to the egg first and fertilizes it, it will result in what? Still female. But if it is the Y chromosome that fertilizes it first, it will result in a male. So I think I've been able to answer your question. Before we move, how can you detect your blood group without doing checkup at the hospital? Now, did you be that? My dear, it's not possible. You have to do it at an hospital. You have to do it at the lab. Now, did you be that? Okay. Actual age for women non-pregnant. I think I've been able to address that. And how to delay ejaculation and last longer. Flame condom. It will delay it. Extra. To give you extra sensation. Does having sex rapidly stop the growth of an adolescent around age 16 to 22? I don't get this question. Please help me to understand better, because having sex over time stop the growth. No, it's not likely. Except there's an abnormality somewhere. But you can as well do well to expatiate. What's the after effect of excessive taking of tramadol? Anyways, tramadol is now an over-the-counter drug, and at times it's being prescribed. It should even be prescribed by a doctor. And if you are getting it from one source or the other, what are you using it for? So that one will help me. But then, it is not a normal drug, basically. Why do some women spot and discharge offensively after using depot injection? Over and over again, I'll say it. This particular one is a myth. It has nothing to do with your discharge. You are taking the depot injection here. How come it gets there? You have an ongoing infection, or you have developed an injection. It has nothing to do with depot injection at all. If you are spotting, fine, side effect. If you are having offensive discharge, it is not depot. There's an ongoing infection out there. How to take care of your tartar as a woman for it to smell delicious and yummy? Why do you want your tartar to smell delicious and yummy? Is it a meat? Do you want to cook it? Is it chicken? The body has a way of taking care of itself. And there's a particular smell that everyone has. It is just neutral. But the moment you are looking for extra smell, you are looking for trouble. Thank you. Can a man impregnate a woman before and later have low sperm count? Of course. If there's an hormonal imbalance, if there's a psychological problem, if there's an obstruction along the path that produces the sperm, yes, a man does. That is the reason why you should not say, because I've had a child before, the problem or the reason why my wife is not getting pregnant is because she has a problem. You check yourself as a man too. Because a man that has actually impregnated a woman before can also develop a problem, can have low sperm count. Very good question. So let's quickly go back. I really want to talk so much about the how we can help you too. Thank you for joining from the Gambia. So let's talk about prostate health. A lot of people do not even put attention to this. Some people are not aware, and it's one of the leading cause of cancer death in men too. Very, very important topic, prostate. A lot of us has heard about prostate, and you are wondering, what is prostate? Where is prostate? Now, just in your pathway of your kidney, then that one leads to the bladder, then you pass your urine. Around there, there's this very small organ, which we call the prostate. And it just encloses around where your urethra is. That's the passage that takes the urine out. Something like a pipeline for the urine to get out in there. So during when there's a problem with that, you might not be able to pass urine. Some men talk about reduced sexual performance as a side effect. Some men cannot pass urine frequently. They have painful urination, and sometimes it stops. Sometimes if you notice as a man that you are urinating, instead of it to go directly down, it's scattered. There's an obstruction somewhere, and that one should take you to the hospital as soon as possible. Now, the signs including you can see pain in your urine or even in your semen. You can be straining. You are feeling like you want to urinate. You are having the urge to go to the toilet. You won't go where you reach now the bathroom. Then you begin the strain. That one might be a sign to prostate health. Low back pain too. And this is very important because for some people, it also leads to sexual dysfunction. So how do you check for your prostate health? It is very important. The same way you want to check your hepatitis B, you want to check for HIV, you want to check your testosterone level, you want to check for your sperm health. It is also important for you to check for your prostate health as a man. It is very important. So how do you do that? We have a test called PSA, and across every of our centers, Mary Stopes Clinic, you can get this PSA done. That is it. Just little things that matter is the one that puts a lot of people into trouble. So you have this test done. We call it prostate specific antigen. There's a particular level it should get to. The moment it's beyond that level, we know something is wrong, basically. So that one is readily available at any point in time. You can just walk in. You don't need to feel sick before you do every of these routine tests. So if you are planning to have a routine test done, add that to it. PSA, very important. Now takes me back to the STI. During the course of the week when we're talking about infection, a lot of people say, men do not have infection. That the women them. Men do have infection. And when you have infection, the way it works is sometimes you do not know. And women, the moment we contract that infection at any point in time, we start having symptoms like abnormal vaginal discharge, burning sensation, itching, foul smelling discharge, because our body is very sensitive. And the part where the urine comes out from, which is the urethra, the opening is very exposed to anything in the surrounding environment. So if you are using it, if you are having sexual intercourse with somebody that has the infection, you pick it up easily. Now, men, do not just decide or do not just feel or assume that you don't have infection. In fact, a couple of times that sometimes you might get infection from your partner, the men has it. They have it and they do not know. So how will you know if you don't check for it? And because your body, in a way, just absorb it. And that is even more dangerous because the more you have infection, the more you keep on having infection over infection, and it will lead to a complicated infection. So what do? You have to test. Very easy, and protect yourself. Safe sex practice. Do not jeopardize that. Do not jeopardize that. It is very important. And trust me, if a man, take for instance now, a man that has sexually transmitted infection like gonorrhea, you might have it now, you take some medication and it's gone. But it will wait for you in the future. That's the way it works. And that's another cause of inability to conceive. Because at that time that you are having post-discharge, your friend gave you one particular concussion and you took it and you thought that was the end. Some part of the pathway where your sperm is coming from, they would have occluded. It would have blocked it. So you cannot produce sperm. So a lot of this infection, including sexually transmitted infection, will later have a long-time effect on the man, leading to inability to conceive. I think we're almost getting to the end of our session. And after this last topic, we're going to talk about I'll look at some of the questions that we have here. So let's talk about penile size. A lot of people say penile size, my thing is not big enough, it's not big enough. Men, if you have any woman that is telling you that it's not big enough, don't mind them. It is totally wrong. And that is because you only need 5 to 6 inches is all you need. If your hole is within 5 to 6 inches, it is perfect. There is no perfect size. There's no any other size aside from having 5 to 6 inches. And of course, when somebody starts discouraging you about your size, the size will only increase when you are aroused. And that's where erection comes into play. Once you can sustain erection, you can achieve erection, there's nothing wrong with you. Don't let that get into your head, and that won't lead you to go and be taking some pills and some cream. Those pills and creams, do you know how they work? Now, let me explain to you. And cream, they actually contain some ingredients or substances, and these substances will cause the release of some enzymes in your body. When these enzymes are being released, they cause vasodilatation. That means arteries, those are the pipes that are carrying blood in your body, they will relax. The smooth muscle there will relax. So therefore, there are a lot of blood flowing in through the vein. You understand? That vein, that passage where blood is always passing through. So when you take that substance, they will release some enzymes. The side effect that those enzymes, they will cause your blood vessels where the blood is passing through to dilate. When they dilate, there's inflow of blood and you achieve erection. But have you thought about it? Many of these things that you take, they are not only dangerous, they are not true, because some of them are just temporary. You and I can agree that after you take it, you return back to the normal size. Some of them don't even have a measurement, and you take them, they are dangerous, and at the end of the day, they cause issues to your kidneys. So all of those things, they are just temporary, and they are not meant to be taken. If you have any issue with sustaining erection or premature ejaculation, it is only experience. It is very important for you to go to the hospital. Your size is perfect, men. Don't let anybody reduce your steeze or confidence. And we have really talked about a whole lot, and I want to believe that a whole lot of men have really gained a lot, and you have an insight about the services that we offer to men. Now, this will be the last question. Can stress delay period? Yes. When you are stressed psychologically, it releases some stress hormone. They can either make you menstruate earlier than you usually menstruate, and they can make you menstruate later than you usually menstruate. Secondly, inside this month, I got spotting twice, but I'm not pregnant, but I have done PT test. Depends on your menstrual cycle, basically. One of the things you want to know is that some women can menstruate twice. Menstrual cycle is not just 28-day cycle, no. There are some people that have shorter, up to 21. So if you have a 21-day cycle length, definitely you menstruate twice. And the way you count it is the first day of your menstruation is your first day of menstrual cycle. So on the calendar, the first day of your menstrual cycle is not on the 1 of that month, no. If you are seeing your period on the 6th of January and you have a 21-day cycle, so you count from that 6, you count 1, 2, 3, 4, 5, 6. When it gets to 21, you will see that you have to start all over again that same month. But if you are spotting, that can be an indication to other things, probably pregnancy, hormonal imbalance. Are you on any contraceptive? Those are the things that you have to take into consideration. I want to believe that we have had such a good time together, learning, unlearning, why men always tell women after sex, they are not sweet. I don't know. Maybe you had salt, you had honey. I really do not understand. I beg. So thank you so much for joining us. I want to believe that you have had a whole lot. And trust me, the same way we had it last week, those that joined first early, they will be having their giveaway too. Now is the time for Auntie Marie to get our own words reward. Can I see those tap? I want to see that like. I want to see that like, because next week again, we are coming with a whole lot of energy. I want to see that like. This time, it will not cost you anything. It won't cost you extra data. If you believe, now I'm not even compelling you. That's the way it is. I'm not compelling you. If you know that you have learned one thing for either yourself, your brother, for yourself as a woman, for your sister and everything, I want to see that like. Encourage Auntie Marie. We are not taking anything from you. We are giving you knowledge. You are able to learn. You are able to unlearn and also help other people to learn. And you will still get reward. You will still get reward. Please and please and please give that like to Auntie Marie. Thank you so much to everyone that has joined. It's been a good time spending with you. And I want to say thank you once again. Until next week when we'll be seeing again, I want to say have a safe and healthy weekend. Don't forget, safe sex practice. Prevent unplanned pregnancy, unwanted pregnancy or unplanned pregnancy, prevents infection. It is very, very, very important. Now, I know a lot of people are planning for Valentine is coming. Hey, where is the... Next week, we'll be talking about what you need to do to enjoy your Valentine period. Trust me, Auntie Marie will always give it to you. So be here, same time, 3 p.m. next week, Friday, where we'll be talking about a whole lot about your health and how well to enjoy your Valentine. Until next week, I want to say have a wonderful weekend. Bye.